What if your body attacked its own arteries? This condition is called Takayasu arteritis. This is an autoimmune disorder that causes blood vessel inflammation. In this condition, the inflammation damages large arteries that take blood away from our heart to the rest of our bodies, and this large artery includes the aorta and its branches. Takayasu arteritis is named in honor of Japanese ophthalmologist Mikito Takayasu. He first reported a case of the disease in 1905. The artery is made up of 3 layers. The walls of an artery is made up of 3 layers. The first layer, which is the outermost layer, is called the tunica adventitia, and the middle layer is called the tunica media, while the innermost layer is called the tunica intima. Now, this inflammation usually happens on the tunica intima, which is the innermost wall of the artery. And when this inflammation happens, it reduces the diameter and size of the artery. By reducing the diameter, it causes stenosis, which means narrowing of the artery. So this stenosis now leads to reduction in blood flow, and this reduction in blood flow leads to a weakened pulse. That is why Takayasu arteritis is also known as pulseless disease. In cases where the major arteries are severely inflamed, the arteries could become totally blocked. This inflammation could also weaken the arterial wall, leading to an aneurysm. Takayasu arteritis mainly affects large arteries such as the aorta and its branches, so it is commonly also referred to as aortic arch syndrome. The signs and symptoms of this disease come in 2 stages. In stage 1, the symptoms include mild fever, muscle and joint pain, unintended weight loss, and fatigue. Not everyone has these early signs and symptoms. The inflammation could be damaging the arteries for years without the person even realizing that something is wrong. In the second stage, the inflammation causes severe narrowing of the arteries, leading to reduction in blood flow and less oxygen and nutrients reaching our tissues and organs. Symptoms in this stage include a weak pulse, pain in the limbs, lightheadedness, headaches, memory problems, chest pain, high blood pressure, and anemia. The cause of Takayasu arteritis is unknown, but it's an autoimmune disease in which the immune system attacks its own arteries by mistake. Takayasu arteritis primarily affects girls and women under the age of 40, and it is a disorder that is seen worldwide, but it occurs mostly in Asia. Sometimes the condition also runs in families. With Takayasu arteritis, the continuous cycles of inflammation and healing in the arteries could lead to one or more of the following complications. It can lead to high blood pressure, it can lead to heart failure, it can even lead to myocardial infarction. It could also lead to hardening and narrowing of blood vessels, which leads to reduction in blood flow to organs and tissues, which could lead to necrosis. It could also lead to stroke, which is as a result of reduced or blocked blood flow in the arteries leading to our brain. It could also lead to transient ischemic attacks, which is nicknamed a mini stroke because it has similar symptoms with a stroke, but it doesn't do as much damage as a stroke. Treatment of Takayasu arteritis focuses on controlling inflammation with the use of medication. Takayasu arteritis can be very difficult to treat because the disease will remain active even though the symptoms improve. The first line of treatment is usually the use of corticosteroids, which helps to reduce inflammation. In cases where the arteries have become severely narrowed or blocked, then a bypass surgery is carried out. This helps to improve certain symptoms such as high blood pressure and chest pain, although narrowing and blockage may occur again, requiring a second procedure. A fun fact to round everything up. Did you know that humans are bioluminescent? It's just that the light that we emit is too weak for the eyes to see. Thanks for watching. Don't forget to like, share, and hit the subscribe button.